Hollywood's biggest night is this Sunday. How do the stars pull off their amazing looks for the evening? Here to tell us some of their secrets is Las Vegas board-certified surgeon Dr. Jeffrey Roth. Welcome, my friend.
Thank you very much. Always great to be here.
It's great to have you here. Now, this is stuff that anyone can do, some tips and tricks for people at home. Let's start. The first thing is skin preparation. How do we begin? Skin preparation,
absolutely. So you see these people on the red carpet, and they're glamorous, and they're fantastic, but you have to kind of set the canvas first, right? So that's hydrofacials, that's Botox, little filler before the makeup goes on, et cetera, et cetera. So again, beauty from within, but then also kind of lay the table.
Let's break down Botox. Okay, I've always thought about getting Botox. How much, if someone wants to start with Botox, how much do they start with? Where do they start? Do they start with the forehead? Do they start the entire face? Where do you start when it comes to Botox?
Well, first of all, you have to look at the individual. When you come to our office or a board-certified plastic surgeon's office, typically they'll go through a history, a physical exam. For example, if you're on blood thinners, if you recently had surgery, et cetera, you may not be a candidate, and that's okay. Then we go ahead and see what the goals are, and then we go ahead and see if we take a look at the anatomy and if we can get to those goals. So you have to know anatomy, you have to know physiology, and for me, you really have to talk to the patient, and that's how you get from point A to point B.
Can we get a shot of this mug right here? Okay. Where would you start on this thing? Right up here, a little up here? Is that where you start?
So you need nothing.
Oh, come on. Yes, we do. There's not enough Botox in the world for this face.
Bad for business. No, typically we put on the face Botox between the eyes, forehead, crow's feet. What Botox is you put the medicine into the muscle, stops the muscle from moving so much, and it mellows out the line on top. Lower half of the face we like the fillers for the nasolabial folds, for the marionette lines, and then lips, of course. With Instagram, everybody goes crazy with the lips. But having said that, is really, you don't want to change somebody too much. You really just want to spruce them up a little bit, get them ready.
Now let's talk about, because these stars are out there on the red carpet, it's hot and everything, how are they preventing sweating?
Sure. So one of the secrets that everybody can do nowadays is Botox in the armpits.
In the armpits?
In the armpits, yes. True story. Because it's 80 degrees on the red carpet, you know, you cover a lot of this stuff. Another 10 degrees with all the lights, and they're nervous, and so what you don't want is pit stains on your Valentino dress, right?
We're looking at, is that Jennifer Lopez there, I think, right there?
Yeah, so these are red carpet veterans. They know what they're doing. Obviously, fresh look, et cetera, fabulous gown, the whole thing. And so she's been prepping for this for months. And some of these things that you can do at home, or you can go ahead and go to the plastic surgeon's office, will help you out. Again, Jen, she's fantastic. Red carpet veteran, always looks fresh, doesn't look overdone, looks absolutely spectacular. And those are the type of things that you want. You don't want overdone crazy on the red carpet or in real life as well.
Let's talk about then some actual plastic surgery options.
Sure. Now, these girls here, again, and the guys too, on the red carpet, typically they'll have little things done along the way as opposed to the blue plate special at the very end. So little nips, little tucks, just to kind of keep them fresh so that you can see them on the red carpet at their very best.
Someone watching right now, what's something they can do right now to improve their skin?
Sure. 1, stop smoking. 2, stay out of the sun. 3, hydrate and moisturize and wear an SPF. That's a basic. And then you can get into peels, you can get into Botox, fillers, plastic surgery, but most of all, just be healthy, and your skin will reflect that.
I love it. Dr. Roth, thank you so much for joining us. Really appreciate it.
It's my pleasure.
Thank you. All right, well,